cancer is the second most common cancer worldwide and the most common in women. Now, new research from Rutgers University finds evidence of a link between use of certain hair products such as dyes and relaxers and a heightened risk of breast cancer in some women. Our medical expert, Dr. Campbell, is here to talk a little bit more about this. And it sounds concerning at the outset. Tell us a little bit more about the study and how it could be related to breast cancer.
You know, in this particular study, almost 4,000 women took part in the Women's Circle of Health study, and the data on them were analyzed. When researchers looked at the data from the study, they found that there were some significant links between raised risk for breast cancer and the use of these hair dyes, chemical relaxers, or straighteners, and that these patterns of risk really differed between white women and black women. For example, in black women, they found that the use of dark shades of hair dye was linked to an overall higher risk of breast cancer. For white women, the analysis found that the use of relaxers or straighteners, either alone or together with hair dyes, was linked to an increased risk of breast cancer.
So is there anything women can do or anyone can do to prevent breast cancer?
You know, every year in the U.S., almost 220,000 women and 2,000 men are diagnosed with breast cancer, and almost 40,000 women and 400 men die from this disease. The risk factors from developing breast cancer include some that cannot be changed, such as age, genetics, age at first menstrual period, and risk factors that you can change include physical inactivity, use of alcohol, and use of certain forms of hormone replacement therapy and contraceptive pills. The most important thing that I think women can do is to partner with their healthcare provider to assess your own individual risk. It's also important for women to perform breast self-exams and have recommended screening visits with mammography when they're indicated.
So after this study, with respect to these hair products, I mean, do we need to stop using them?
You know, I think the first thing to do is not overreact to this study. It was a really small study, and it really didn't prove cause and effect. However, it does really make us want to do more research to examine how exposure to hair products and other potential carcinogens may contribute to the development of cancer in both men and women. For now, again, I think it's important to talk with your doctor about your breast cancer risk and make sure that they know your family history and all your risk factors so you can do the right things for your best health.
All right, Dr. Campbell, always important information. If you'd like to learn more about this topic, or if you have another health-related question for Dr. Campbell, you can always find him online at WNCN.com.